Okay? Finish? No, second question. Which cell type produce vitamin B12 in our body? Fatty acid produce B12 in our body. None of cells in our body don't produce any vitamin B12 because production of B12 in our body is done by microbes or bacteria, some bacteria that reside in large intestine. Okay? And the next question, do you think the B12 produced in our body is useful for body? Yes. Yes? Of course. Because the RBC product produced by bacteria, pay attention to me. RBC produced by bacteria in large intestine. Okay? But absorption of B12 in our body is in small intestine. Okay? So the B12 produced by bacteria is not useful for RBC production because this B12 don't be able to absorb in our body. Okay? So we need B12 and this B12 should be provided from diet. Okay? Yes? B12 should be provided from diet, and you know no vegetable origin. That means B12 only exists in carnivorous diet. For example, exists in milk. Okay? But as I told you, synthesis in body by bacteria, absorbed in the small intestine, specifically below, and it's very important to know the absorption route of B12. Pay attention to me, please. There's B12 combined or attached to R binder. R binder is specific proteins that produced by salivary glands. Okay? And this combination occurs in the stomach. Okay? And what is the role of R binder for B12? R binder protect B12 from digestion by gastric acids. Okay? And after interest to the small intestine, we have dissociation between B12 and R binder. That means B12 released in the small intestine. Okay? And at the small intestine, again we have combination of B12 but in different proteins named intrinsic factor. Intrinsic factor. That this intrinsic factor produced by the stomach. Okay? Produced by the stomach, released in the small intestine. At the small intestine, we have combination of B12 and intrinsic factor. Okay? And what is the role of intrinsic factor for B12? Protect B12 against digestion by proteolytic enzymes in the small intestine. Okay? And finally, this complex complex enter to enterocyte and after it's absorbed in blood. Okay? Any question? Forms of B12 and folic acid are essential for RBC maturation, and both of them should be provided by diets. And if we have deficiency about B12 and deficiency about folic acid, we will have immature RBC or non-functional RBC. And immature RBC are different in shape. You know, normal RBC has biconcave shape, but immature RBC maybe have, for example, oval shape or spherical shape or any unusual shape. Okay. And again, immature RBC is different in size. For example, immature RBC are bigger than normal RBC. Okay. And you know, immature RBC has fragile membrane. You know fragile membrane? Easily destroyed. Okay. And finally, immature RBC has shorter in life. Okay. What is lifespan of normal RBC? 90. It's about 120 days, about 4 months. But immature RBC is about a few weeks. For example, 2 weeks, 3 weeks. Okay? So, immature RBC is not functional in our body. And for maturation, we need to B12 and folic acid. Review question. Number 1, you please. Read the first question. Which option is correct? What? Okay, you please. Number 2. Number 2. And hydrous. C is correct, okay? You please. Yes. Little low. Which following is incorrect? Pay attention to incorrect, not correct. You don't know. Which of the option is B? D. Last choice, D. D is incorrect sentences because you know that RBC don't have same thickness. Okay? The thickness of RBC are different. For example, thickest at the margin and thickness at the center. Okay? in the blanks. Which option? C. Yes, C is correct. Because A is incorrect, because liver produces RBC at the middle stage of trimester. B is incorrect because bone marrow produces RBC at the last month of gestation and after birth. And D is again incorrect because the lymph node, as same as liver, produce RBC at the middle trimester of gestation. What do you think about this question? Which type of bone terminated RBC production early? Line bones. Okay. So if the line bones for RBC production earlier, that means A is incorrect. Again, C also is incorrect because femur and tibia, both of them are belong to line. So the correct answer is B. Because I told you the bone marrow of short bones produce RBC production in overall life of overall period of bones. Okay? Fill in the blanks. D. A is incorrect. Hypoxia increase. Hypoxible, inducible factor. C is incorrect because hypoxia increase. Okay. All of you see this table. You should match each word of column A, which is best option for column B. For poroericoblasts, which of them is correct? Yes, multinucleated and biggest. Okay? For reticulocytes, which of them is correct? Present in blood circulation, and there are additional another choice for reticular erythrocytes. Diapedesis. You know diapedesis? As I told you, the reticulocyte be able to leave the bone marrow and enter to blood circulation. Okay? Diapedesis means leave tissue and enter to blood circulation. Okay? So, for reticulocytes, force of diapedesis and present in blood circulation is correct. For basophilic erythroblasts, yes, one, stained with basic dye. And for mature RBC, again, yes, maximum content of hemoglobin and present in blood circulation. Okay? About first one, B12 R binder complex. For this complex, which of choice is best?
Last one. Last one.
Form in the stomach. Okay? The second, B12 intrinsic factor complex. Which one? No, salivary glands produce R1, only R1. But for B12 intrinsic factor complex, form in or occurs in duodenum. Okay? It's correct. B12 R binder cleavage. You know this cleavage means dissociation. B12 R binder cleavage is in occurs in small intestine or again occurs in duodenum. B12 intrinsic factor absorption. Again occurs in duodenum. Because duodenum is part of the small intestine. And finally R binder. Yes. Produced by salivary. Okay, so production site for intrinsic factor. I told you intrinsic factor produced by gastric cells, produced by stomach. Okay? No. We have some abnormality in regards to RBC. There are two important abnormalities. One of them is related to decrease in RBC amount and the other related to increase of RBC amount. At first, decrease in RBC amount or anemia. You know anemia? Anemia means deficiency of hemoglobin in the blood. It's a standard definition of anemia. Decrease in hemoglobin. This decrease caused by too few RBC or too little hemoglobin in the cells. There are different types of anemia. First, aplastic anemia. Okay? Read them. Read the properties of aplastic anemia. You please. Yes.
Anemia deficiency.
No, aplastic anemia.
Aplastic anemia means lack of functioning bone marrow.
Aplastic anemia means bone marrow without any function. What happens if bone marrow don't have any function? What happens? RBC don't produce. Okay? And anemia occurs. In some situation, we have aplastic anemia. For example, exposure to high dose radiation or chemotherapy. Because high dose radiation or chemotherapy be able to destroy the bone marrow. Or for example, high dose of certain toxic chemicals. Or some autoimmune disorder. For example, lupus erythematosus. You know autoimmune disorder? Autoimmune disorder, you know? Can you give me example for autoimmune disorder? For example, multiple sclerosis or MS. And finally, idiopathic aplastic anemia. What is the meaning of idiopathic? Without any reason. Without any non-reason. It's idiopathic. Okay? Without any non-reason means idiopathic. The other type of anemia is megaloblastic anemia. At megaloblastic anemia, RBC form are mostly oversized or have bizarre shape. You know bizarre shape means unusual shape. Have fragile membrane. These cells rupture easily. We have, pay attention to it, we have megaloblastic anemia in situation that B12 decrease in our body. In other words, B12 deficiency leads to megaloblastic anemia. Hemolytic anemia. Hemolytic anemia means the RBC has fragile membrane and is easily destroyed. So the hemoglobin released from RBC to blood circulation means hemolytic anemia. There are subtypes of hemolytic anemia, for example, tertiary spherocytosis, sickle cell anemia, and erythroblastosis fetalis. Okay, but it's very important to know the effects of anemia in blood circulation. Anemia, the RBC amount is decreased. Okay, it's blood anemia. If we have decrease in RBC, the blood viscosity is decreased. You know viscosity? Viscosity means resistance against movement. Viscosity is opposite than fluid. Okay, for example, viscosity of oil is more than viscosity of water. Okay, if we have decrease in RBC, the blood viscosity is decreased. Decrease in blood viscosity leads to decrease in resistance to blood flow in the peripheral blood vessels. Decrease viscosity, decrease blood resistance. Then we have increase in blood return to the heart. And if we have increase in blood return, we have increase in cardiac output. Okay? So what is the effect of anemia on cardiac output? Increase. Okay? Decrease viscosity, decrease resistance, increase blood return, and finally decrease cardiac output. Okay? Another abnormality regarding RBC is increase in RBC amount that make polycythemia. Okay? Polycythemia means increase in RBC production. Both of anemia and polycythemia are dangerous for body. Both of anemia and polycythemia are pathological or abnormal situation. But what is the effect of polycythemia on blood circulation? At the first, we have increase in blood viscosity. So we have increase in resistance of blood flow, decrease in return in blood, decrease of return blood, and finally decrease in cardiac output. But in other hand, you know, at polycythemia, the blood volume is increased because the number of RBC are increased. After increase in blood volume, we will have increase in blood return to the heart. And after increase in blood return, we have increase in cardiac output. So in one hand, we have decrease in cardiac output, and in other hand, we have increase in cardiac output. These two factors balances each other. So the final result of polycythemia on blood circulation or on cardiac output is no difference, is no effect, is no change. Okay? Anemia. Increased cardiac output, polycythemia, without any effect on cardiac output. Okay? Thank you.